Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the host of the Dean's Chat podcast, and I'm the dean at the Arizona College of Podiatric Medicine. My guest today is certainly immersed in all things podiatric medicine. Dr. Alan MacGill is a successful podiatric physician in South Florida. He is the residency director for the Foot and Ankle Surgical Residency Program at HCA Florida Northwest Hospital in Margate, Florida. He is on the board of directors for the American College of Foot and Ankle Surgeons. He's board certified by the American Board of Foot and Ankle Surgery, and he also does case review for the American Board of Foot and Ankle Surgery. He's faculty for AO Trauma North America. Welcome to Dean's Chat, Dr. Alan MacGill.
Thanks for having me, Jeff.
You know, Alan, we talked about doing this, if you remember, back at the ACFAS meeting in February, and here we are like 6 months later, 7 months later. So thanks for joining me.
No worries. It's been a long time coming. This is exciting. I'm happy to be a guest.
Oh, that's great. You know, Alan, we have kind of a fireside chat vibe, so we go by first names. Let's go Alan and Jeff, if that's okay with you.
Absolutely. I've listened to a few of these in the past, so I know the format.
All right. Sounds good. We'll deviate a little bit. So I didn't read a long bio for you because I thought maybe to kick off the Dean's Chat episode today, you could kind of give us some background of how you found out about podiatric medicine and your journey that led you up to going into practice, for example.
Absolutely. I went to the University of Florida. I was doing my undergraduate, and I knew in high school that I wanted to help people, and a lot of different professions can help people, but being a physician, being a doctor was just something that had some allure to it. And I know that when I was in school, I had grades that were admirable. I worked hard. Admittedly, I was not the greatest test taker, and one of the things that I struggled at was the MCAT. And I started looking at my options, and I said, what are my options? Do I want to apply to medical school? Do I want to take a year off? Do I want to get a master's in something? And I looked at some other things that maybe had the option for me to dive right in. And before I applied to podiatric medical school, I said, I think I need to shadow. I need to spend some time in the clinic. And I reached out to two podiatrists who were in the Gainesville area. And the first person who I shadowed, he'll remain nameless. I went into the office, and one of the things he says, "Are you sure you want to do this? You really shouldn't do this. You should, do something else. You should go to medical school." And it was almost a reverse psyche on me. Instead of being a detractor, it was almost a motivator. And it was really, it just had that complete reverse effect. So I said, maybe this is, just not a unique experience, or maybe it is a unique experience. This is probably not for everybody. So I called someone else up, and the second person who I shadowed was a young practitioner who was very, very enthusiastic, completely different. And it was night and day. And it was look at all the cool things that we do, and look at how I'm interacting with my patients and all the cool things I'm doing with my patients. And that person was Michael McGlamry. Oh my gosh. And I had no idea who Michael McGlamry was at the time. And of course, after I get accepted to podiatric medical school, and I'm opening up my surgical textbook, I see the name McGlamry, and it hits me. I'm like, oh my God, this is the son of Dalton McGlamry, who's the godfather of one of the godfathers of podiatric medicine. So that's kind of my story and how I got involved.
Wow, I love that story, actually. That goes to show you, Alan, putting my AACPM hat on for a second, and you're with ACFAS, we're working together on the student recruitment effort, and right. Having doctors that are with ACFAS, they're board certified, they're younger, they're excited about the profession. Those are the docs we want our prospective students shadowing, like yourself.
Absolutely. Yeah. I mean, like I said, it just makes a difference. The enthusiasm and just being able to kind of share what we do with prospective students. I think that goes a long way, and, just enlightening how good our profession is.
Absolutely. So how'd you find your way to Scholl College?
So when I was in Gainesville, I joined a fraternity, and I was part of the fraternity, and they had a leadership school, and part of their leadership school, they would send some of the executives to their headquarters. Well, my fraternity was Sigma Alpha Epsilon, and they had a leadership school in Evanston, Illinois. And I think it might have been my junior year at University of Florida. And I remember flying into Chicago. I took the train. And as I rode the L, I remember looking out the window at the city and saying, no, that's a city. that's a big city. I grew up in Tampa. So Tampa at the time was my big city, but that pales in comparison to Chicago. And spent maybe 4 days in Chicago downtown. And I told myself, this is amazing. This is someplace that I could see myself spending time. And when it came time for applying to podiatry school, I had some options, but Chicago was the top of my list. I knew I wanted to go there. It's
a funny how an environment or a city can get an emotional attachment on you so easily, That's great. I work with Dr. Wu all the time, and I've worked with Dr. Parsley before that. The Scholl College is a great school. And just a side note, Alan, when Dan Hatch and I started the North Colorado Surgical Residency Program, it was the Scholl College that provided the funding to do it.
Oh, nice.
Yep. So we are in lockstep with Scholl, taking their students in for a clerkship and residency initially. So I always feel good when I talk about Scholl, for sure. So you were at Scholl for 4 years, and then what was your clerkship experience like, and how did you end up back in Florida?
Clerkship experience, it was interesting. Back then it was a lot different. We had manuals. We almost had these printed manuals where we would flip through, and it would have the program kind of demographics on it. And then at the bottom, it would almost have typed almost reviews from previous students. The program was great. The people were nice, high volume surgery, or sometimes there were negative things. And I knew that being in Chicago, I kind of wanted to make my way back down to Florida, but I just didn't know this program from that program. I almost kind of picked randomly, which in hindsight, I probably would have talked to more students. I probably would have done a little bit more research, but I kind of did a hodgepodge of programs down in the Florida area. So as you know, that's taxing. If you're up in Chicago, you're driving constantly back and forth. 1 month you're driving down to Florida, you have to turn around and then to go do a whole month or a rotation back home, and then you turn around and do the trip again. So that's what I did. I tried to put my eggs in the Florida basket for at least residency programs.
Oh, that's great. So you ended up going to East Orlando, which is notably one of the top residency programs in the country. I'm always so proud of our students when we match there with one of our students. What was that experience like? And Alan, if you wouldn't mind, let's talk about some mentorship too. Who are your mentors? But let's talk about the residency program first.
Yeah. So I went to a couple programs, and I tell students jokingly, I say, you're going to go to some programs and you're going to just feel like you fit in. You're going to love it. You're going to enjoy the company. You're going to feel like you have mentorship. And then you're going to go to some other programs, and you may know pretty early on that this is not for me. And that's okay. You obviously want to try to find the fit for you. When I went to Orlando, that was the fit. And I kind of knew right away that this was a place that I could see myself, almost similar to where, I told myself that Chicago was the place that I could see myself. Before we started this podcast, we were talking about, situations where you show up at almost at a program and God forbid there's not an affiliation agreement in place and you have to leave or you have to vacate. Well, that actually happened to me. And when I was in South Florida, I had spent a week at another program and they turned around and unfortunately they said, the agreement's not in place. You can't be here. You have to leave. And I didn't know what to do. So luckily I had already spent my month in Orlando. I picked up the phone and I said, can I come back? Can I spend the next 3 weeks with you guys? And they said, sure, come back. So I was really fortunate. I got to spend a total of 7 weeks with this program that, it's just a big interview. They get to know you, you get to know them. And I think that's what was also helpful in me getting that program. You talked about mentorship and, some of my, I've got a lot of mentors, and I could sit here and name lots of people, but one of my mentors and someone who had an impact was Dr. Chris Reeves. And as you know, Chris went to Barry and he was practicing in the area. He was a younger practitioner at the time, but him and his wife, Amber Shane, were heavily involved in the program. And if anything, they were, academically driven. They were doing some of the bigger cases, which are alluring to students and residents. But more importantly, I think they had a strong involvement in the profession and they had a strong involvement in the college. And that's something I think that they instilled in the residents. So it's not only we want you to be good, we want you to be well trained, and we want you to be academic and good physicians and surgeons, but we also want you to be active in the profession. We want you to get back, and we want you to volunteer your time. So I've tried to kind of carry that on, at least with my involvement.
That's interesting because mentorship is so important, and we always want to emulate the people we admire, right? And so Chris and Amber are wonderful, and I always appreciate it when they send us students. But what a fabulous program that continues to be. So what did your practice situation end up like right out of residency that kind of led up to you becoming a residency director? What's that path look like?
Yeah, so I'll tell you kind of a hard story. I also tell residents and students, there's a lot. This whole journey is like a roller coaster. So when you're a fourth year student and you match with a residency program, you are at the peak. You feel like you can conquer the world. The world is your oyster, and you feel so good. And then all of a sudden, you start residency and you are at the bottom of the barrel. It feels like you can't find your butt with two hands sometimes. Okay. And you are starting over, and you're learning, and you're drinking from a fire hose. And then you get to third year of residency and you feel like you can conquer the world again. Okay. And one of, I think, the problems is that when I was looking for jobs at the end of my third year, I remember I got paired up with a group who needed someone. This was Southwest Florida. And they gave me an offer. And, it's difficult trying to gauge your worth. And the offer that they gave me, it was pretty good. But then you look at classmates who are getting offers different areas of the country, and you forget that it's not apples to apples. Okay. What someone's getting reimbursed in Florida may not be the same as what someone's getting reimbursed in the Midwest or the Northwest or somewhere else. But you see these things and you think, I'm worth more than that. And I remember distinctly saying, thank you very much for the offer. Here's my counter. And I countered, and they said, thank you very much. Don't call us, we'll call you. Oh. And usually when you hear that, that means that they're going to move on to the next person. So I didn't get that job opportunity, and it was a job opportunity that I won. It taught me a tough lesson. Maybe I should have had a little bit of humble pie in terms of, just taking that as someone coming out, and then of course working up. What ended up happening is I did take a job. I took a job with the podiatry group, which was in Southeast Florida, and I worked with that group for 8 years. The group started small. The group grew in terms of associates and different practices, and that was really a good situation for me because I had mentors in practice. I was able to learn the business. I was able to learn, efficient patient management. I think we get out of residency and we can tackle the surgical problems, but sometimes just being efficient in clinic and knowing how to just talk to patients about these problems in clinic is a lot different, and maybe not something that residents are as honed into. So that was very helpful, at least for the first 8 years of my career.
That's a good story. And I always, whenever I hear stories like that, I always think to myself, well, hey, at least you had options, right? You had the option to counter, Right. So that's great. Well, all things are well that ends well. That mentorship is so important. And then when you started to give back to the profession, I think the ultimate way to give back to the profession is to be a residency director, Alan. How did that play out? How did you find yourself in a position to work with the residency and then become the director?
Yeah, good question. When I first joined the group, the podiatry group that I was with, the person that hired me actually had just started another local residency program, and it was in its infancy. And 2 residents came on, and then another 2 residents, and I started working with them from a kind of really my second year in practice. And it was great. It was great because I loved residency. I loved just being involved, being part of a team. I loved being able to, again, work with my attendings. And now I'm on the other end, and I'm kind of instructing. But at the same time, I'm not that far out from my training. And as this continued to go along, I became more involved. I took some roles in terms of research director or whatnot. And we had kind of a nucleus of people as part of this residency training program. And in the back of my head, I always kind of thought, at some point I feel like I could do this. There were some things I would do similar. There were some things that I might, do differently, but I feel like I could, emulate this if I had the chance. Fast forward however many years, maybe another 7-8 years from when I started, and we had opened a satellite office across town. And one of the things I said is I'm going to get on at this hospital. There is another hospital over there, and I know that they have a residency program. I just don't know if I'm going to be involved. And it was kind of last second I got involved or I got on staff. And I remember distinctly one of the things I did is I tried to make an appointment with the CEO. And I sat down and I said, hi, I'm Alan MacGill. I'm a podiatrist, podiatric surgeon. I'm new on staff. I previously worked with the residency program. I know you have a residency program here. I would love to be involved. I talked to the residency director and really just offered to help out. And I just remember they said, thanks. That's great. We'd love to have people who were involved. And even though I thought I was going to be at hospital A kind of across town, I ended up being at hospital B across town a little bit more. And it just so happened that I think it was like a year later that the position opened up and they had a call for applicants. And I submitted an application. There may have been, I'm guessing, maybe 6 total people. And when I had my interview, I distinctly remember telling the people, the CEO and a couple other people at the table, I said, listen, this is what I love to do. Okay. And whether I get the job or not get the job, it's not going to change. I'm going to be here. I'm going to work with them. And that was the truth. I mean, would I love to have the position? Absolutely. But was it going to, if I didn't get it, am I going to turn around and leave? No, because I like to teach. And I think that in hindsight, that may have had, maybe the final deciding factor for them, at least on the other side of the table. I'll never know. They never told me, but I would like to think it did.
Hey, the cream always rises to the top, Alan. There's no doubt about that. Congratulations. Hey, can we talk about your residency program for a few minutes?
Sure, absolutely.
So, a lot of students listen to Dean's Chat, and a lot of students are asking me every year, where should I go do my clerkships? What residency programs? I want to do the Florida tour and all that. Give us some background. Kind of give us the elevator pitch on your program.
Sure. We're in the northwest corner of Broward County. So if you fly into Fort Lauderdale and you drive west, maybe 20 minutes, you're going to hit our hospital. We're part of the HCA family of hospitals. There's a bunch of different HCA facilities down here, many of them with podiatric residencies. And that's actually been a good thing because as this family of graduate medical education grows, not only in podiatry, we kind of we reap the benefits of what some of these other ACGME programs. So we're seeing more benefits, more resources, better facilities. But we take 2 residents per year. It's obviously a 3-year program. As of late, we've had more and more residents who have desired fellowships and who have fortunately been accepted to fellowship. So we're seeing more and more of that. I know prior to my arrival, that's not something that was really even in discussion. To my knowledge, the fellowship experience has grown, but we've got, a good mix. I know students hear that all the time, but it's a mix of elective forefoot. We talk about the bread and butter surgeries that the average podiatric physician is going to encounter. We get trauma at a local level 1 trauma center, which the residents, get to scrub, which is great. They're working with orthopedic traumatologists over there and some of their, podiatric faculty. We have almost a faculty plastic surgeon who residents scrub almost all of their cases, which is great to get that kind of, tissue handling techniques and suturing techniques and rotational flaps and whatnot, even as first-year residents. So we do that. We do cadaver labs every month, and we sprinkle in as much academics as we can pack in the week without driving ourselves crazy. But that's pretty much it.
Oh, that's great. My students that I've rotated with you have come back and just said it's been a wonderful experience. And I know you've got one of our students now also. I just thought I'd share this story with our listeners. Last month, we had a student in Florida who all of a sudden the hospital said they weren't credentialed, and there was no fault of the students, and they had paid for Airbnb. And I called Alan, and I asked Alan if he'd be willing to let our student do rotation at his hospital. And we all jumped through hoops. You jumped through more than I did, but thank you for making that happen, Alan. I just think that was so nice of you and your team there.
Yeah, no, our pleasure. And it worked out well. It was a great student. Happy to have him.
Oh, that's great. So let's talk about your involvement with the American College of Foot and Ankle Surgeons. You're on the board now. How did that play out, and where did you start? And I know a lot of students are active in clubs as students, right? ACFAS club and all the different non-surgical and surgical clubs, and they have dreams of being on the board someday. How did that play out for you, Alan?
Oh gosh, it was a long road. Getting on the board, I tell people is it's generally pretty hard, and I feel like I kind of took a little bit of a side door route, and I'll explain that. I've served in the past on the nominations committee, and that's a committee of people who essentially vet the applications for the people who are going to be put on the slate, and the membership votes on that. Jeff, if I could tell you, the last couple of times I've done this, the people who apply to these positions are overly qualified beyond what you can believe. I mean, resumes that are so long, and almost anybody who applied could really be put up on that. And a lot of times it's just name recognition, and the people who get voted in are people who have lectured and who are very visible. That's not me. I'm not very visible. So I knew that at some point I wanted to get involved. And one of the ways for me to get involved was when they had an open call for regional officers. So for those students who may not know, ACFAS has our national organization, which is all the members in the country, but then it's subdivided into regions. Actually, when I got on, it was even further subdivided. It was, I think, divisions. There may have been 15. Now there's closer to 8. But there are local officers within these regions. And there was an open call in the state of Florida for the lowest level. It's the secretary treasurer. So I said, all right, I'm going to do it. I'm going to throw my name in there. And I applied. And I think that there was maybe 2 other people, and I lost. I didn't get it. So the next year rolls around, and it's the same thing. It's the open call for the secretary treasurer, and I apply. And I think I lost. So I lost a second time. And I had a local colleague who was involved in the college, and she said, you got to keep going. You got to keep going. So the third go around, fortunately, I won that position, but I think that's because I ran unopposed. So I got on, and there's kind of a track as your secretary treasurer. Another year rolls up, you move on to vice, and then you move on to president. Well, when you're president of the region, you end up attending the region's president's council. So all of these region presidents get together and they have meetings, and then there's some degree of more centralized involvement. I served on that for, I want to say, a couple years. And then ultimately I was fortunate enough to take the role of chair. The chair of the RPC, or the Region's President's Council, has a seat on the board of directors. So for 2 years, I served in that role. I decided after that I wanted to run. I ran officially, and I was fortunate enough to get voted on kind of the traditional way. And then actually, I'm hopeful that now that my term is up, I'm hoping to run for a second term. We'll see what happens in this fall. So if I get that opportunity, that'd be great, because I truly enjoy serving and on the board.
That's fabulous. Congratulations. So what does a board member do? What are the responsibilities of a board member at ACFAS?
Yeah, good question. So the board, I believe it's a total of 11 members. There's obviously the executive board. There's the immediate past president, the president, vice president, and then secretary treasurer. And then you have your essentially, call it members at large or elected board members. The board is responsible for really the oversight of the college. And the financial responsibility, making sure that obviously the money that comes in and goes out is being accounted for. But what we do is we help oversee some of the position statements that come out. We oversee some of the committee work that gets done. As you know, there's a lot of different committees that ACFA has, ACFAS has. That's the fellowship committee, postgraduate affairs committee. There's membership. There's consumer education. There's just a ton of committee work that the college is involved in. The primary function, for the most part, is really education and delivering education to the members. So That's really our work. We meet 3 times a year. We meet at the ACFAS annual conference. We have a summer meeting, and then we have a fall meeting. Actually, our fall meeting is going to be coming up in a month, and we rotate at all of the local colleges. This year, it's going to be at Scholl, so it'll be a kind of return home for me.
No, that's great.
In a sense.
It's amazing. There's so much that goes on behind the scenes, and you don't realize how much work it is, but it does get done, and it takes a lot of dedicated individuals. So thanks for all you do. That's for sure.
Yeah, thank you.
So tell me what it's like to do case review for ABFAS.
Case review has been a very eye-opening, process, and it's something that's rewarding too. And in terms of case review, just to give a little bit of a background, I honestly, not without, spilling all the details, but essentially people who are trying to get board certified by American Board of Foot and Ankle Surgery, when they have amassed enough diversity of cases, they will submit their cases. Their cases are selected randomly. I know a long time ago, candidates had the benefit of really just handing over their best work. They would say, here are my best 20 cases or my best, 30 cases for review. And, that work was typically perfect. It was excellent outcomes and perfect work. But that may not be the best representation of a surgeon if it's cherry picked. So now these cases are randomly drawn. And what it entails is really a lot of different case reviewers come together for a couple days at a time, and we essentially review these cases. We review the preoperative x-rays, we review the immediate post-op x-rays, we review the final x-rays, we review the notes, we review the surgeon's notes, the anesthesia notes, the hospital notes, and these are essentially assessed. There's different grading scales in which these cases are graded, and they're graded not just by one person, but by multiple people. So, my assessment may be different than the person sitting next to me or the person 2 seats down. But this is really the peer-reviewed process, and it is very eye-opening to see some of the work that's being done. There's a lot of good work, and sometimes there's not so good work, if that makes sense. But it's been very helpful for me as well, as a surgeon, as a practitioner.
Sure. And that's, again, giving back to the profession. So thank you for doing that. That's great. I wanted to shift gears a little bit. I follow you on Facebook, and I see you're a prolific triathlete.
I don't know if I call it prolific.
Well, I threw that in there, but I noticed that you're not all work and no play.
No, I that's kind of been my fix as of late. And there was times I've gone through phases. Before kids, I used to play a lot of racquetball, and I'd be in the gym for 3 hours at a time, 3 times a week. And then you have kids, and it's hard to get that permission slip signed by upper management. That doesn't fly when 2 kids are at home. So racquetball kind of fell by the wayside. I know even before that there was a lot of golf, and I like to play golf, and we would play softball with some of the friends after having played baseball in high school. But now it's really training triathlon. It's biking, cycling, running. I mean, those are the things that help me kind of relax and reset, if you will.
No, that's great. What's your best event?
My best event is cycling.
Right.
I kind of started at cycling and got into that. And then somewhere along the lines, one of my previous practice partners says, what, we should do a sprint triathlon. And I said, that is insane. I'm not a swimmer. I can't imagine doing that. And at one point you kind of say, what the hell, let's go for it. And you kind of train for it. And I remember it was raining the day of the sprint triathlon. It's freezing cold. And I'm thinking, this is mad. This is madness. And then you do it and you're like, I can't wait to do another one. This is great. So it's just kind of grown. It's grown on me.
I biked a lot and I ran a lot, but wasn't a swimmer. So I never did triathlons. Was that your last sport to learn?
That's the most recent. I mean, and running, I used to have to run for conditioning. I never really liked it, especially when you live in Florida. It's a gazillion degrees outside. It's humid, it's miserable to run. So It's been kind of a love-hate relationship, but the more you do it, the more you get comfortable, the more, you get better at it, and you start to like it a little bit.
Yeah, it's like anything. Competence and confidence go hand in hand. That's great, Alan. So, Alan, what would you tell a prospective student that's interested in going into podiatric medicine?
Prospective student, I think you really have to have a genuine interest in wanting to make a difference in people's lives. You want to have to help people. And I think that the majority of us go into it for those reasons. And if you want to have a positive impact on people's lives, I think that this is a fantastic way to do it in this profession. I think you also have to be comfortable with the things that we treat. If you don't like blood, if you don't like foot wounds, if you don't like, incisions and trauma and things of that nature, this may not be the right thing for you. So it's always a good idea to test the waters, to shadow, to talk with people who have kind of been through this, to do your due diligence. But I think that when you do that, I think that you'll find that there's a lot of people who have had successful careers, who are financially very stable, who are happy with the quality of their lives, and the impact that they make on their patients on a daily basis.
Well said. Yeah, I couldn't said it better. That's just fabulous. And I agree with that. And the students are always coming into to do interviews, right? And I'm always shocked if they haven't done enough shadowing and they really don't quite know what they're getting into. And then I try my best to set them up with a doctor wherever they're from so that they really do get a firsthand experience of what our great profession is all about. Well, thank you, Alan. And I thank you for taking time at the end of your day and jumping on the Dean's Chat with me.
Yeah, my pleasure, Jeff. I really appreciate it.
No problem. And we're going to send you one of these Dean's Chat cups,
nice.
and early morning coffee or before you get your workout in or something. You'll remember our chat on Dean's Chat. So again, thank you for all you do. Thank you for all you do for the profession. And really, Alan, thank you for helping out our students. Our students love coming down to your program. So I really do appreciate that.
Yeah, we'll keep taking them if they have an interest. That's great.
Sounds good. And to all of our listeners out there, if you're listening on Apple Podcasts or Spotify, please give us a 5-star rating. If you're on YouTube, please become a subscriber. And until next week, cheers, everyone.